Today I will be irrigating my patient who just has a urinary retention. I'll be irrigating him with normal saline, which is compatible with his medication, gentamicin, which I'll be instilling just as gentamicin is just an antibiotic for his UTI that he might be having. And I'll be administering 10 milliliters of this and keeping it still for 2 hours. Before I do that, I am going to check my MAR, plus check my the doctor's order of the gentamicin against the MAR twice, and the third time will be by the bedside. I'm going to check for any problems such as any side effects or any adverse effect that the patient might have or might have complained of with the medication. I'm also going to check to cross-check whatever medication that he's taking, just so that we don't have any problems with any medication reacting against each other. So now I'm going to go to my bedside, my patient's bedside, introduce myself, ask them for the name and date of birth, and name the date of birth, and also any allergies that you might know of. Then after that, I'm going to go perform hand hygiene, provide privacy, perform hand hygiene, and now I'm going to put on my glove. I'm going to tell my patient what I'm going to do, which is to irrigate his, just irrigate his catheter and just irrigate his bladder, just to take away any clot or obstruction that might be holding, that might have occluded the catheter, that might have caused that urinary retention. So now I'm going to make sure that everything is all right. I am going to prepare my flush, my normal saline flush.
Alright, so with that, I've noticed that I did go after that in a straight line over my sterile gloves, because I no longer have a sterile glove. Let's say this is my dirty football again. Now I still have my clean gloves on, after cleaning, then I take it away.
And just to get it all out of the way, I'm also going to prepare my gentamicin medication.
We're good. When did I practice? Pro sterility, recognizing that.
I use this cup.
I'm not letting go because we're going to go and get close to the right? So, I'm good. That's what
And I will be doing an the open way method for with my irrigation, and the closed method when I'm administering my medication.
Says that the patient should bear down, which that kind of closes things off. So I will be asking my patient to relax and exhale. But again, the book right here.
So I have my irrigation and my medication ready.
Keep in mind,
I'm just going to tell the patient to just relax, to take their breath and breathe out slowly. I'm going to position him, do a little bit of perineal care to just clean this area, just to make sure there isn't any, just check for skin integrity and just proper cleaning. I'm just going to take this glove off and wash my hands again and put in my sterile glove, because this has to be a sterile practice. I'm going to tell my patient that the gentamicin might have just 2 side effects. Just they might feel a little dizzy, and they should expect their urine being a little orange than usual. All right. Now it's time to do my flush. And I have performed perineal care. Everything is perfectly fine. Going to keep this.
If they're ambulatory, then I'm going to
Gonna make sure this is away from me and just remain sterile. Gonna get my gentamicin. Flush it in.
secure that to just
I was like, are you left? No, okay, because I was like, grabbing it.
Alright, at that point, there is no resistance, so I'm sure that whatever that is occluded, the catheter has been released. I'm just going to put this in a drain, in a basin or urinary urinary cup, just so that he can just urinate everything that has been, all the clots or whatever that has occluded it or any stone. So that has happened. Everything is fine. Just for safety practice reason, not because this touched anything, but just to be safe. It's better safe than sorry. I'm just going to clean the end just to continue that sterility while I put this back in there. Alright, now I'm going to administer my medication, gentamicin. I have told the patient the side effect that they might have, such as dizziness or or orange urine. I'm gonna change my gloves, of course, put in a new pair of gloves, and this can just be a clean procedure since I'm not really going or opening anything. But I have to still clean with my alcohol swab. And for the medication, I am going to kink this part of the catheter. And it's always better to kink it to get as close as you can be to the port.
It doesn't work very well.
Now, since I've touched this, I have to clean it again. Now I'm going to administer my medication. Just put it straight up. And then trying to also make sure that it is, we're not having so much that is flowing down into the catheter. So everything is going down in there, down towards the penis. So I'm just gonna have this kinked for 2 hours because that is the doctor's order. Make sure that the patient is safe. Make sure there is no. Make sure he is safe. Make sure he's at the bed at the lowest level. Just make sure that everything is fine. He's not experiencing any dizziness as of right now. So this being kinked. Lower the bed. Take my gloves. Perform hand hygiene. Go over to the MAR and document whatever I did, such as I'm gonna document the amount of normal saline I irrigated with, the amount of gentamicin that I gave, the amount of urine the patient had after I irrigated, and also I'm going to also document the level of consciousness and like how well the patient was able to withstand the tolerance level to the whole entire process. I'm also going to make sure I cross-check and I have made sure I follow the patient's 6 right, document, and I'm going to sign out.